Hi, and we're back. Health This Week. I'm Don Baillargeon. Thanks for staying with us. As type 2 diabetes increases in prevalence, so does hypoglycemia, which can occur from taking too much insulin or too much oral medication. Now, a new study featured in the diabetes-themed issue of the Journal of the American Medical Association shows that just one severe bout of low blood sugar could have a serious health consequence. Haley Weldon has more in this week's Journal of the American Medical Association report.
Frank Gold was diagnosed with type 2 diabetes in 1982. Since then, the number of people with the condition has skyrocketed.
Estimates from the CDC show that there's been a doubling of prevalence from 1990 to 2005, and this is considered of epidemic proportions.
Like many patients, Frank has managed his disease by tightly controlling his blood sugar levels with medicine and insulin, until recently.
4 months ago, the procedure has changed to allow me to have a higher blood sugar.
His change in treatment was a direct result of new research that looked at how episodes of low blood sugar, called hypoglycemia, that required a trip to the hospital could impact future risk of dementia in patients with type 2 diabetes.
This is a very important question to answer because we are expected to see a doubling of the prevalence of dementia in the next 50 years. And if the CDC estimates hold true, we will also see more type 2 diabetes.
Dr. Rachel Whitmer of Kaiser Permanente Division of Research led the study that appears in this week's diabetes theme issue of JAMA, the Journal of the American Medical Association, analyzing the medical records of over 16,000 elderly patients in a Northern California diabetes registry from 1980 to 2007.
We were able to look historically at their records and see who had a very severe episode of hypoglycemia and whether it was associated with an outcome in late life.
Researchers found that 1,465 patients had had one or more serious hypoglycemic episodes between 1980 and 2002. And in the following 4 years, nearly 17% of those patients were diagnosed with dementia, compared to only 10.34% of patients with no history of hypoglycemia.
It really adds to the evidence base out there that perhaps very low glycemic targets might not be the best way to go in elderly patients with type 2.
I've known that hypoglycemia is very bad, loosening up on the insulin. Hopefully this will keep dementia from springing up.
Identifying this important link is one step toward that goal. Haley Weldon, the JAMA Report.
I'm joined now in studio by Dr. Linton Smith. He is a member of the Orange County Medical Association. He's a family practitioner with a concentration in geriatric medicine. Dr. Smith, welcome to the program.
Thank you very much for having me.
Now, Doctor, we all know, and of course the statistics bear fruit to this, that diabetes is becoming an increasingly urgent problem worldwide. I mean, more and more people every day are being diagnosed with this disease.
That's true, and we've changed the diagnostic criteria, which is one of the big issues. And of course, people are living longer, which develops more and more people developing. And the last issue is the epidemic of obesity, which is a hallmark sign of diabetes.
Of course, yeah. I mean, you know, anytime someone is dealing with obesity, more than likely they're also probably, if not already, but are dealing with a diabetic condition.
Correct.
Now, as we saw in the piece that we just looked at, for someone who is trying to control their diabetes and perhaps there's too tight of control, as you mentioned before going on the air, it can cause a hypoglycemic condition, which now this study is telling us could lead to dementia later in life. What's your take on that?
Very big concern about this. In my training, we were always cautioned about the issue of hypoglycemia being more dangerous than hyperglycemia. Now, the newer thought process is to develop very tight control. Try to get very low blood sugars in the morning, maintain a very low sugar during the day. However, the cost of that is increasing episodes of hypoglycemia. And this study is a frightening thing to think that this might lead to dementia down the road, because dementia, as we know, is a major health crisis in America.
Well, of course, now, in dealing with your patients, and as we mentioned, you have a concentration in geriatric medicine. So you are dealing with patients that are, you know, fearful of one and probably dealing with the other. What is it taking from, what can you take from this study to help your patients?
Well, I think the study is to be sure we don't create hypoglycemic episodes in our diabetic patients. There's not a lot of study that shows that very, very tight control improves the longevity of patients. I think we have to take a step back, look at our control of diabetes, and make sure it's appropriate, not too tight, but certainly don't want to have high blood sugars. I think we need to step back a little bit and say, are we doing the patient a service by keeping their sugars too low? And we think the big emphasis will be avoiding hypoglycemic attacks.
Now, very quickly, we're almost out of time, but a lot of times you're watching television and it's beginning to look like in commercials that controlling diabetes has become a really easy thing, but maybe we're looking at it a little too lightly?
Absolutely. I think we have a new series of medications that have come out because the understanding of diabetes has totally changed over the last 10 years. There are very complicated micro activities that are going on in the diabetic that we're just grasping right now. So the numerous medications are out there, but the emphasis should be good control, avoiding too tight a control, avoiding hypoglycemic attacks.
Sage advice. Again, Dr. Litton Smith. He is a member of the Orange County Medical Association, and we thank you so much for your input.
Thank you very much for having me again.